The purpose of the swinging flashlight test is to compare the strength of the direct pupillary response with that of the consensual response in the same eye.
Before anything else, it is important to greet the patient and introduce yourself as the clinician. It is also important to sanitize your hands and the instruments you will use before the procedure.
The setup for swinging flashlight should be dim room illumination with headlamp. The patient should be instructed to remove their spectacle correction and a distant, non-accommodative target should be utilized. Standing off to one side, the clinician should instruct the patient to fixate on a distant, non-accommodative target. The light beam is directed into the right eye and held for 2 to 4 seconds. Then quickly move to the left eye and held for 2 to 4 seconds. This process should be repeated for at least 3 to 4 cycles. When moving the light between the eyes, use a slight U-shaped motion, making sure to avoid the penlight crossing the patient's visual axis, which may stimulate accommodation. It is critical that the magnitude and duration of the light be kept the same for each eye. Observe the response of the pupil receiving the light, the size or rapidity of pupillary escape, and the response and size of the pupil not receiving the light. A normal response should show equal direct responses between the two eyes, equal consensual responses between the two eyes, and equal direct and consensual responses of both the same eye. In addition, the rate and amount of constriction should be the same for both pupils. If the patient has normal results, then the patient has normal pupillary function. The acronym PERLA is often used when recording pupils, which means pupils are equal, round, and reactive to light and accommodation. If the patient does not have normal results, it is necessary to document the presence of a relative afferent pupillary defect.